If you've noticed a neck hump forming at the base of your neck, you're probably not happy with how it looks. It can make you feel older, more hunched, or just not like yourself. And you may be wondering if this neck hump is just cosmetic or if it is something that will keep getting worse. In this video, I'm going to explain what actually is causing the neck hump. You will also learn why it often progresses if you ignore it, and what you can realistically do to fix it. Now stay to the end, because I'll also give you a simple test you can do at home to see how far things may have already shifted. I'm Dr. Graham Jenkins, a corrective care chiropractor in Kelowna, British Columbia. I help patients restore their health, mobility, and confidence through advanced non-surgical spinal rehabilitation. I'm one of only a few doctors in the world who are advanced certified in chiropractic biophysics, and one of just 3 on the west coast of Canada. My focus is real correction, not just temporary pain relief. On this channel, I share clear, evidence-based videos to help you understand your spine, improve your posture, and move with confidence again. If you're ready to take control of your health and protect your spine for the long term, subscribe to my channel. If you've noticed a neck hump forming at the base of your neck, it usually doesn't feel just like a small cosmetic issue. It tends to catch you off guard. You might see it in the mirror, notice it in photos, or hear a comment that makes you more aware of it. For many people, this brings a level of self-consciousness that wasn't there before. You may start avoiding certain angles, adjusting your posture more often, or feeling like you look more hunched over or older than you used to. One of the biggest frustrations I hear from my patients is that they can tell something is changing in their body, but they don't understand why it's happening or what it actually means. And that uncertainty starts to build. Is this just posture? Is it fat? Is it something more serious? And is it going to keep getting worse over time? And I can tell you, most people are not thinking about spinal structure or forward head posture. They're simply trying to make sense of what they're seeing. And that's exactly where the confusion around the neck hump really begins. The next step people often take is to type something into Google or maybe your preferred AI platform like Chat or Grok. There, they'll read sources that say it's just fat. Some sources say it's bad posture, and then they come across things online that makes it sound like it could be something more serious. See, that mix of information creates a lot of uncertainty and concern. And one of the biggest concerns people have is whether this neck hump is something that will continue to get worse over time if nothing changes. Most people assume the neck hump is a simple surface issue, but in practice, I see the opposite. What looks like a small change on the outside is often connected to something deeper that's been developing over time. Now, part of the confusion comes from how gradually this shows up. It doesn't usually happen overnight. It builds slowly through daily habits like sitting, driving, and looking down at screens. Because of that, it's hard to pinpoint when it actually starts. Unfortunately, most people only start paying attention to it once the neck hump becomes visible, or worse, becomes painful. By that point, the underlying changes have often been there for a while. So before you can do anything about it, you need to understand what you're actually looking at. What is actually causing this neck hump? Now, in many cases, it's not just fat at the base of your neck. It's often a visible sign of how your spine has shifted over time, especially at the transition between your neck and your upper back. This is the C7-T1 area, and it's also called the CT junction, or the cervical thoracic junction. This is where the neck hump is commonly located. The CT junction acts like a hinge point. As your head moves forward over time, that junction becomes more prominent, and that is what creates the appearance of a neck hump. Now, it's important to know that a forward head posture does not usually happen in isolation. It's usually part of a larger postural pattern that includes rounding of the upper back. Now, in some cases, the body may lay down a protective fat pad in that area, in the area of C7 and T1 in response to repeated stress on the joints. So what you're seeing on the outside is often a reflection of a deeper structural change underneath. Now, here's the next thing that is really important to understand. Not all neck humps are the same. There are generally 3 categories to be aware of. The first is a postural or structural neck hump. This is the most common. It's linked to that forward head posture and something called thoracic hyperkyphosis, where the spine shifts and creates that visible prominence at the base of the neck. The second is a protective fat pad. In this case, the body lays down tissue over that area in response to repeated mechanical stress around the C7 to T1 junction. And the third, which is less common, involves hormonal conditions such as Cushing syndrome. These cases have different underlying causes and need proper medical evaluation. The important thing to understand is that these can all look very similar on the outside, but what is actually driving the neck hump underneath can be very different, and that changes how it should be approached. To understand a structural neck hump, you have to look at the pattern it sits inside. It's not just about one spot at the base of your neck. It's a part of a larger structural shift that involves both the neck and the upper back. A pattern that shows up again and again is forward head posture combined with thoracic hyperkyphosis. Your head gradually moves forward and your upper back begins to round more than it should. As that happens, the lower part of your neck, especially around the CT junction, starts to translate forward. That creates a peak at the base of the neck, which is what you see as the neck hump. Most people assume they just need to pull their shoulders back or do a few posture exercises. But in practice, I see the opposite. When the structure has already shifted, those simple exercises don't address the underlying abnormal position of the spine. This is why the neck hump tends to persist, because it's not just a bad habit. It becomes a pattern that your body starts to hold onto over time. One of the biggest concerns people have is whether a neck hump will keep getting worse. And in many cases, it does if nothing changes. This comes down to how the spine adapts to long-term positioning. When your head stays forward for hours each day, whether that's from sitting, driving, or screen use, the supporting ligaments begin to slowly stretch. A pattern that shows up again and again is that this process happens gradually, so most people don't notice it until the changes become visible or painful. This is referred to as ligament creep. Over time, the structures that are meant to hold your spine in a more neutral position lose some of their ability to do that effectively. It's kind of like repeatedly spraining your ankle, and the ligaments get looser and weaker. So as the ligament support decreases, the head shifts further forward. The upper back rounds more, and the neck hump becomes more pronounced. And because this builds slowly, it tends to feel like it's happening without a clear cause, even though the pattern has been developing for years. At first, a neck hump often feels like a cosmetic issue. It changes how you look, and that's what gets your attention. But over time, it can start to affect how your body feels and functions day to day. A pattern that shows up again and again is increasing neck pain and muscle tightness through the neck and the upper back. As the head shifts forward and the upper spine rounds, those muscles are under constant strain just to hold your head up. That can lead to ongoing stiffness, reduced mobility, and headaches that become more frequent or harder to ignore. In some people, I also see symptoms like numbness and tingling into the fingers, and that usually reflects added stress on the nerve system as the posture continues to change over time. You may even notice your breathing feels more shallow, especially when your upper back is more rounded. Now, we do specific lung function testing in my office with a test called spirometry. I can't tell you the number of people whose lung function improves when we correct their neck hump and their hyperkyphosis. Now, when it gets to this point, it becomes obvious that this is not just about how the neck hump looks. It's now about what that neck hump is doing to your spine, your nervous system, and your lungs over time. This is also where a lot of frustration comes in. Many people have already tried to fix their neck hump, but nothing seems to make a lasting difference. You may have tried stretching, posture reminders, or exercises like chin tucks. Those can sometimes help temporarily, but they often don't address what's actually driving the problem. Most people assume that if they just sit up straighter or strengthen a few muscles, the neck hump will go away. But in practice, I see the opposite. If the spine's already shifted forward, simple exercises don't reposition that structure. A pattern that shows up again and again is people doing the right things but at the wrong level. They're working on muscles while the underlying issues involves the position of the spine itself. As we mentioned before, we need to address the ligaments. And this is exactly why a structural approach matters. Without understanding the structural component, it becomes easy to feel like you're doing everything right, but still not seeing change. So at this point, the question becomes, what can you actually do about a neck hump? Now in our office, we start with a comprehensive posture exam and a full spine x-ray analysis. See, the goal is to clearly identify and measure the postural displacements and spinal misalignments, especially in the cervical spine, where this often relates to forward head posture combined with thoracic hyperkyphosis. With this level of testing, we can quickly determine that neck hump is not just a single isolated issue, but part of a larger shift in how the spine is positioned. Having an accurate diagnosis is half the battle with addressing your frustration and determining the root cause of your problems. Once that is identified, we can apply chiropractic biophysics corrective methods. This includes mirror image exercises, mirror image adjustments, and mirror image traction. These techniques are designed to move the spine in the opposite direction of the displacement, helping to facilitate a correction towards normal alignment. So we're dealing with muscles, ligaments, bones, and the neurological programming that keeps your posture stuck in place. So as you can see, this is much more than just doing a few chin tuck exercises. It's a structured, logical, full spine analysis and corrective process. Now, I've been fortunate to work with dozens of patients who've seen a visible reduction in their neck hump on posture photos, along with improved cervical and thoracic alignment on x-ray. And most important of all, they often tell me that they feel more confident and comfortable in their posture again. And as I mentioned before, we see their spirometry numbers go up, so their lung function is returning. So here comes the fun part. What can you do at home to get a better sense of your neck hump and posture? As promised, I'm going to show you a simple test you can do to see how much things may have already shifted. Stand with your back against a wall, with your heels close to the wall and your hips and mid-back touching it. From there, try to bring your head back so it touches the wall comfortably. If you can't get your head back without tilting your chin or straining, that's often a sign that your posture has already shifted forward. One of the biggest things patients notice when they try this is how difficult it feels, even though it seems simple. If that's the case, a simple place to improve this is with a basic positional exercise. Start by lying on your back and letting your head settle into a more neutral position. What you're trying to do here is gently encourage your head and neck back toward a more aligned position, without forcing it. You should feel a mild stretch through the front of the neck or a light pressure at the base of the skull, but it shouldn't feel strained or uncomfortable. Now hold that position for about 3 to 5 minutes, breathing normally and staying relaxed. Each day, gradually increase the time by 2 to 3 minutes as it starts to feel easier. As long as it feels comfortable, work your way up to about 15 or 20 minutes per day. As that begins to feel easier, you can gradually progress by placing a small folded towel under your mid-back to gently encourage more extension through the upper spine. From there, you can eventually introduce some gentle foam rolling. It's really important to keep your head supported so you're not straining your neck and inadvertently causing another problem. Now, for some people, when they start out, even these exercises feel challenging, and that's okay. The goal is not to force the correction all at once. Remember, this has taken time to develop. We want to begin by restoring a more natural position gradually. You now have a clear understanding of what a neck hump is, the different types, how it develops from a structural perspective, and how it can be addressed with a more comprehensive corrective approach. If you found value in this video, like and share it with someone who is dealing with the same issue, but maybe doesn't really fully understand what's happening. If you have a question about your neck hump or what you're experiencing, drop it in the comments below. Subscribe to my channel to keep learning practical, evidence-based ways to improve your posture, protect your spine, and keep your body strong over the long term. And if you want to go deeper, especially into exercises that target thoracic hyperkyphosis, which is one of the main drivers behind a neck hump, watch the next video on your screen.